The data we are seeing is alarming. From 2023 to 2025, trauma admissions related to e-bikes and e-scooters at Stony Brook Children's Hospital has increased significantly. Each of these cases represents a child, a family, and a community affected by injuries.
What is an e-bike? That's the question everybody asks. It's less than 20 miles an hour, and then we have e-scooters. E-scooters can only do 15 miles an hour less. That's what we see a lot of the parents buying for their kids is these e-scooters and e-bikes. And parents are not educated to the fact that 15-year-olds are not allowed to own these legally in New York State or in Suffolk County.
I cannot tell you how, when you see the stats, how many children are under 16. They're on scooters, they're on e-bikes, they're on collapsible things, they're on sit-down ones, riding their friend on the back without a helmet too. So this is really the problem that confronts us.
I've been taking care of trauma patients for almost 40 years, and I've never seen such an explosion in the amount of admissions that we've seen over the last few years with these micromobility or e-scooters and e-bikes. It's phenomenal. As this graph represents, in the last 5 years, we've probably seen a hundredfold increase in the amount of admissions. We regularly see children with real significant head injuries that are going to be life-altering for these patients, and we have had fatalities. Some people would call these accidents. I think that implies that it's random and not preventable. These are not accidents. There are things we can do to minimize the amount of patients that we're seeing. We need to educate the adult riders. We need to educate the parents who think they're buying a toy for their child, that they don't realize what a dangerous weapon this can be.
Even just for the community to know that this is such a rising issue is really important. I think a lot of these parents maybe often don't have any idea of these dangers, and so just to bring it to light is super important.
Enforcement goes so far, but it's really education that changes how people think and creates compliance. That partnership between the police, between the school districts, between Stony Brook, I think is how we win this. I think it's we have great partners in this, and I think together we can kind of change the way people think.
And the question is, how do we get them to listen? This is a great start. It is a great start to bring attention to the issue that needs comprehensive legislation. And if we make our voices heard, hopefully we can bring change. Thank you.